All right, guys, so most dentists, they just walk into the room, say hi to the patient, introduce themselves, look at the x-rays, and get straight into just rumbling off a bunch of dental jargon. But that first impression, that first 30 seconds is the first domino in case acceptance. If you fumble that, everything after that gets harder, and you just find yourself fighting not only against your patient, but against yourself. So in this video, I'll show you how to start your appointment with warmth and how that alone can shift everything for you. So let's walk through this specific technique that I've used to help me produce over $1.5 million in gross production. And a way to prime your patient to not just say yes to treatment, but to really garner their trust. So step one is actually going to have nothing to do with you or the patient. It's going to be huddling with your dental assistant. So when you come into a new practice, you want to build rapport with your dental assistants, and you want them to know, hey, when you bring the patient into the room and after taking x-rays for them, have some small talk, ask them personal questions, get any type of insight into any interest, hobbies, or things that they may mention other than their chief complaint. So you want to talk to your dental assistant, ask them what is their concern? Do they seem anxious? Did they tell you anything about themselves that had nothing to do with dentistry at all? Small things like, do they like to golf? Do they have grandchildren? Anything that you can work with to help you build that rapport even faster. So now that you got some of that ammo, let's talk about how to use it once you walk into the room. So first and foremost, you want to have a personalized greeting. Greet the patient by their first name, mention any of the ammo that your assistant may give you, like them having grandchildren or, hey, I heard you like to golf. And really just spend that first 20 to 30 seconds not even talking about their chief complaint or dentistry at all. Just address them, sit in the moment, make eye contact, and give them time to have a normal conversation. This has to do with your body language and how you say things as well. So one of the things you really want to do is sit beside your patient, okay? Don't sit across from them. That subconsciously makes them feel like you're in opposition. So you want to sit next to them, make eye contact when they're speaking, use active listening, make sure their headrest is comfortable. And that right there is going to just completely disarm them. And you go from just being a dentist to someone that they trust and they see as an authority. So now that they feel comfortable, it's time to lower the walls even more with body language and nonverbal communication. So one thing I already mentioned is sitting next to the patient. So that's something that's very important. It completely makes them feel like you're on their side and you're kind of like a friend that's just telling them, what's going on, and you're just here to help them. The second thing is you want to mirror your patient, right? If your patient is soft-spoken and quiet and kind of introverted, that's how you want to be. You want to be quiet. If they're more outgoing and they're, cracking jokes and they have a sense of humor, you also want to match that, go along with it, okay? If they lean forward, you lean forward. If they cross their legs, 10 seconds later, you can cross your legs. This mirroring subconsciously makes the patient feel safe, okay? And don't ask me why, but this have been studied by psychologists, but it is a signal of safety when you do these things. So by now you've started to build trust, right? You've introduced yourself with a personal message, let them talk, had a normal conversation, sat next to them, made them feel warm, mirroring their body language. So here's how you're going to reinforce the collaborative teamwork type of feeling with the patient. And the main way to do this is after you've done the other things you mentioned, it's time to set the expectation, okay? So you may want to say something along the lines of, all right, so, it's been great talking. So I just want to give you a little overview of what you can expect today. We're going to just basically go over the x-rays. I'm going to take a look in your mouth, address the concerns you mentioned. Then we're going to kind of work together to make a plan. Does that sound good to you? Always end with a question, right? Like make the patient be interactive in this and not you just talking to them like they're just a brick wall or something. This makes the patient feel like, look, you're not here to just sell them something, but that you're just here to help them make a decision and present them with information so that, they can figure out what's best for them in getting their, problem solved. So what we just covered today is just one part of the framework that I've built to help me gross produce over 1.5 million and earn over $420,000 just 2 years graduating out of dental school without being an owner and without specializing or doing crazy implant or surgical procedures. So this is just one small thing, you can do that I've done. You'll build stronger connections with your patient, establish trust with them, and you'll have less objections, right? And less rebuttals for the things that you're going to recommend. So if you found this video useful, you made it this far, thank you so much. Please subscribe, like, and comment below. Let me know what else you guys want to see, and please join my private Skool community. It's completely free, and my gift to you guys for joining is to just give you as much value and answer any questions. There's nothing off the table. So link for that is in the description. Thanks, and see you guys in the next one. Peace.